Well, hello, and welcome to Chapter 21, looking at cardiovascular and systemic diseases. I'm going to talk about several different diseases that may or may not be on your exam, but the fact that you may see them in your practice, or these are diseases that are doing damage worldwide. So let's take a look here in Chapter 21. You need to be able to define these three terms: septicemia, bacteremia, and toxemia. So septicemia is any microbial infection. That could be viral, it could be an amoeba, it could be a fungus among us, but it's any microbial infection. Bacteremia, remember that the end part, emia, means blood. So this is bacteria in the blood, which is bacterial septicemia. Toxemia is toxins in the blood. Tox for toxins, emia for blood. And then last we have lymphangitis. Itis is inflammation. Lymph we know as the lymph system. So here we have a bacterial, viral, fungal, some kind of microbial infection that's causing inflammation in the lymphatic vessels. So we look here at this picture and you can see this red stripe is lymphangitis. So this is an inflamed lymph vessel along the arm. And it is highly indicative of some kind of septicemia. Toxemia symptoms are different for different toxins. Exotoxins are released from the living organisms, and endotoxins are released mainly from gram-negative bacteria. Here is a picture of petechiae. Looks like teeny tiny little bug bites. So what are the virulence factors? Well, septicemia and toxemia are caused by various bacteria. Often we see that these can be opportunistic, or they can be associated with being in a healthcare facility or surgical procedure. Most septicemias are caused by gram-negative bacteria. Usually this has an origin in peritonitis, where the small intestine or the large intestine has ruptured in some way and the peritoneum has become infected. Once it becomes infected, then the bacteria can move to the circulatory system from the peritoneum. The bacteria that have capsules or can resist phagocytosis, so that is going to prevent some of the immune response. And a lot of times when we treat bacteria, we want to give a drug that's called a siderophores, that's a hard word to say. And what this does is this drug scrounges iron. Bacteria need iron for their metabolic processes and to live. And if they don't have iron, they can't live. Some endotoxins, and remember these are toxins that are released when the bacteria ruptures, are going to trigger very serious problems. How do you get septicemia? Well, you can rub dirt in your boo-boo and that'll give you septicemia. People who are immunocompetent rarely have septicemia because our immune system does a really good job of protecting us. But if we're already sick and we have problems, we're exposed to other bacteria, this can become opportunistic, cause major problems. Also, we can see that endotoxins that are released when the bacteria are killed or die will activate the immune system, and sometimes we have a little overreaction. So if we look at an endotoxin called lipid A of lipopolysaccharide, this is a very nasty endotoxin, and you can see that it will trigger platelet and blood clotting reactions and cause what we call disseminated intravascular coagulation, also known as DIC. So here we have the formation of blood clots, and of course blood clots can lead to death. Leukocytes reacting to lipid A release cytokines. Tumor necrosis factor and interleukin-1 will cause fever. Interleukin-1 will result in the release of neutrophils, and those neutrophils don't really know what to attack, so they attack everything. Interleukin 6 and 8 start to attack everything, and this is what can result in big bruises, plasma loss, reduction in blood pressure. And then lipid A will activate complement C3A and C3-5, and that causes inflammatory in between the blood loss, reduction of blood pressure, and inflammation results in shock. And we all die from shock eventually. How do we diagnose? Signs and symptoms. Have you noticed how so many of these diseases are diagnosed not with tests, but with signs and symptoms? How do you treat? Antimicrobial drugs and supportive treatment. How do you prevent? Well, how about we wash our boo-boos? Okay? How about we go to the doctor when we're ill and get drugs to help us be healthy? Endocarditis is one of the few inflammatory diseases that attacks the heart directly. And so inflammation, itis, endocardium, so the inner lining of the heart is infected, undergoes an inflammatory response. We see fever, fatigue, malaise, difficult breathing, tachycardia. Oftentimes these can be caused by the bacteria that we find in our mouth when we get, maybe we don't take good care of our teeth and they start to rot, or we start getting gingivitis really bad and the bacteria overgrow in the mouth, get swallowed, wind up in the blood system, and in the blood system then of course they're going to be exposed to the heart and they infect the heart. Pathogenesis, patients usually have an obvious source of infection. If your patient has abnormal heart valve, this increases their risk, and an embolus can form, and this can block the blood vessels in other organs. What is an embolus? Okay, an embolus can be a blood clot. It doesn't have to be. It can be a foreign object embolus, like a bullet, a piece of wood, or it can be a clump of bacteria, a clump of a mixture of a blood clot and bacteria, but you think of it as something that is large enough that it can block small arteries. We can have major problems. Once again, diagnosis and treatment. Symptoms. If the heart valve has an infestation on it, that infestation is called a vegetation. Not vegetables, vegetation. And we can see it on an echocardiogram. How do we treat it? IV drugs. If you go to the dentist and you have a heart problem, a lot of times they'll want to put you on antibiotics. If you're immunocompromised, they'll want to put you on antibiotics before they clean your teeth or do any kind of dental work. Let's look at systemic diseases. So this is where the disease is throughout the body, and the pathogens can get anywhere they want if they're in your lymph system or in your cardiovascular system. One of the big diseases that caused massive pandemics hundreds of years ago, not so much now, is what we call the plague, also called the Black Death. And it's caused by a bacteria called Yersinia pestis. Some epidemiologists will argue that it's something else, but so far the current data holds with Yersinia pestis being the causative agent. There are two types of plague. There is the bubonic plague and the pneumonic plague. The bubonic plague, the bacteria get stuck in the lymph nodes, and the lymph nodes enlarge and enlarge until they kind of stick out on the skin, and those are called buboes. That may be where we get our short boo-boo from. The pneumonic plague occurs when the Yersinia pestis spreads to the lungs, gets into the lung tissue, and this develops into a pneumonia, and it is usually 100% fatal. It's nasty, nasty pneumonia. So the virulence factors in this Yersinia: adhesions, type 3 secretions, which capsules on the bacteria, and other anti-phagocytic proteins. So your immune system really doesn't have a chance to grab hold of it and kill it. So here is a child with bubo. You can see the lymph node here in the inguinal area that is swollen and sticking out. Sometimes those will turn black because the tissue dies, and as the blood breaks down, the tissue dies, then they will manifest a black color. So what do we know about the epidemiologists? Well, it's transmitted by infected animals or flea feces. And in fact, fleas can carry this and bite you, but if it's inhaled, then you're probably going to have pneumonic plague. Like I said, it's 100% fatal if untreated. Bubonic plague is 50% fatal if it's left untreated. So when we look at diagnosis, we look at symptoms. It has to be treated immediately. There are different antimicrobial drugs. Sometimes it takes a cocktail. But the best way to prevent this is, quite bluntly, have a kitty cat, because, or maybe a little rat terrier, because they're going to kill the rodents, and the rodents are carrying the fleas. And so you get rid of your rodent infestation, and you're going to get rid of the plague. And then, of course, good hygiene, staying clean. That helps immensely. So what we see here is that here in the United States, the natural reservoir is going to be any kind of rodent. And a lot of times the Yersinia is in the rodent, and it doesn't bother them. But the flea comes along, takes a blood meal, the bacteria replicates, and then when it takes a flea bite, fleas poop when they bite, and it itches because they put a anticoagulant in with their bite so that your blood won't coagulate on them. And then you rub the feces into the bite, and ta-da! You have Yersinia pestis in your bloodstream. Now, if it's in the bloodstream, it's probably going to wind up in the lymph node, and you'll have buboes. It could go ahead and get into the cardiovascular system and wind up in your lungs and give you pneumonia. Or someone who has the bubonic plague, it can develop from them. They can cough, sneeze, etc., and it comes out and is airborne, and you inhale it. Gee, does that sound familiar right now, guys? Anyway, you get pneumonic plague and then you die. So now would be a good time to take a break and look over your notes. Go ahead and stretch. Here we go. One disease you might see, but maybe not, but you might see it in campers and hunters, is Lyme's disease. There are 3 phases. You have a bullseye rash, neurological symptoms, and then severe arthritis. So here is the bullseye rash. Problem is you only see it in about maybe 30 or 40% of the cases. But when you see it, you go, oh, Lyme disease. This is caused by Borrelia burgdorferi. And a lot of times we'll use manganese, IV manganese, instead of iron. And this little bacteria will take up the manganese, and that way it will have plenty of metabolic activity. And it can alter its membrane proteins. Oh, sneaky, sneaky bacteria. So now your immune system goes, what's you? Deer ticks carry the bacteria. Guess what we have a lot of in East Texas? Deer. Guess what they have? Deer ticks. Aha. So here is a bacteremia slide, and you can see all the red blood cells with the Borrelia bacteria. They are spirochete. The life cycle is pretty complex, but basically what happens is that you've got a happy little larva that hatches and it crawls up on vegetation, and then it jumps on some kind of little animal that goes by. It becomes infected with Borrelia when they feed on either mammals or birds. And then in that first year, the Borrelia multiplies in the infective larva. It goes around, it becomes a nymph. Okay. And then in the spring of the second year of its happy little life, the infected nymphs feed on animals or humans, and that can cause Lyme disease there. They can develop into adult ticks over the summer, and the female tick, the adult ticks are going to feed on deer and other animals and mate in the fall of the second year, and they lay eggs, and then you get a larva, and it goes wound and wound and round and round. So, what's the moral of this story? Spray with bug repellent when you go outside, or just stay indoors where there are no ticks. Mainly, we're going to find people with Lyme disease are going to be hunters, people who camp out, people who enjoy being outdoors in wooded areas. And so one of the problems that we've had in the United States is that we've let the deer population overpopulate, and the foxes that were responsible for controlling small rodents have been hunted out, and coyotes, who really eat rabbits and larger mammals. They will eat the small mammals, but they prefer the larger mammals. And so now the mouse population is out of control. So you see here this huge increase in the number of cases, but notice where most of them are located: in the Northeast and the upper Midwest. Yay, we don't have a lot. Texas has very few. New Mexico has 0. Colorado has 0. All right. Vacation in New Mexico and Colorado. Woohoo! All right. Diagnosis and treatment, signs and symptoms. Antimicrobial drugs, A lot of times people just have to work through it. But when we look at this, how do you prevent? Okay, protective clothing. Don't run around in sandals, no socks, and short pants. Use tick repellents. Use bug spray. I'm a big believer in bug spray. One disease you are going to see is infectious mononucleosis. Aha! It is caused by Epstein-Barr virus, called EBV or HHV4. Most of the time I hear EBV. So basically what happens is EBV establishes a late infection and it suppresses apoptosis of B cells that it has infected, and it can cause many other diseases. More than likely, all of us have EBV in our system. It's just that our immune response is taking care of it. What are the signs and symptoms? Sore throat and fever, followed by swollen lymph nodes, fatigue, loss of appetite, and sometimes a skin rash, but not always. And so when we look at BVV, EBV, if their tongue looks hairy, oral hairy leukoplakia, and you look kind of at the edge of the tongue and you see the white spots, okay, leukoplakia. Burkitt's lymphoma, nasopharyngeal cancer, chronic fatigue syndrome, and Hodgkin's lymphoma. The immune response is poor. And remember, this is cellular immunity, okay, adaptive. People can have it and be asymptomatic, and the cellular immunity is immature or it's not responding. And then infectious mononucleosis, what we see is that the immune response is too rigorous, too vigorous. And so you see a lot of monocytes and in response to this viral infection. So transmission is by saliva. That's what happens. Sometimes we call this the kissing disease, but you can also get it by sharing drinks, sharing toothbrushes, sharing food, sharing eating utensils, things like that. The virus is going to invade and infect the B lymphocytes. Most of us, as I said, have been exposed to EBV and we have antibodies to EBV, and so we don't see the disease. But it's not unusual to see it in teenagers. Their immune system may not have had the opportunity to make the antibodies. So what we see are very large lobed B lymphocytes and neutropenia. Remember, neutropenia means few neutrophils. Treatment is supportive and prevention is almost impossible since it is found everywhere and we all have it. Another viral disease you'll see is cytomegalovirus. Cytomegalovirus is asymptomatic in most of us. We see complications with fetuses, newborns, and the immunodeficient. Birth defects can occur if the virus infects stem cells in an embryo or fetus, and the virus is called the cytomegalovirus. Yay! Transmitted by direct contact with body fluids or transplacentally, which means it crosses the placenta, which is very scary because incredibly few things do cross the placenta. It's a common infection among us, and CMV, all right, becomes latent, and so it can hide and then pop up later when your immune system's not doing well. Diagnosed by looking for large cells that have inclusions. I'm going to show you a picture of that. Nothing really works except for supportive treatment. And, oh, bummer, no vaccine. So do you see what's called the owl's eye? Whoo, whoo. Those are inclusions. Those are inclusions. And this is a cytomegalovirus infection. And that is in the kidneys. That is not good. Okay, dengue fever. The reason I want to talk about dengue fever is that there was a big outbreak of 2 or 3 years ago in Mexico, and it came up through Texas along the border. Didn't make it much past Houston, but you can have dengue fever or dengue hemorrhagic fever. In dengue fever, you have fever, edema, headaches, muscle pain, and then you kind of get over it a little bit. You don't feel as bad, and then the fever returns and you have a nasty red rash. In dengue, hemorrhagic fever is much worse in that it causes internal bleeding, shock, and usually death if left untreated. There are 4 different strains of dengue viruses, and our nasty little mosquitoes are the vector. They bited you and inject the virus into you, and you get sick. Dengue fever itself is usually mild. Hemorrhagic fever is very severe. And as the mosquito, with global warming, the mosquito genus species has traveled further north, and so we're seeing more of it in the United States. Diagnose on signs and symptoms. No specific treatment. What do? Spray bug spray on you. Cover yourself up. African viral hemorrhagic fever. Ebola. Ebola. Okay, fever and fatigue, minor fatigue. And usually by the time you see minor fatigue, you are well on your way to severe internal bleeding, and it kills you. What they have found with Ebola, Marburg virus, we don't see that as much as Ebola right now, but just wait, it'll happen. Basically, the virus interferes with blood clotting, and so you start to bleed freely. You see people who will have bleeding from their ears, nose, mouth, eyes, even from the pores of their skin. If you want, go ahead and go to either the World Health Organization or the CDC and read up on Ebola, because it has made it to the United States, but only in maybe 4 cases or 5 cases, and it was quickly contained. But when this goes through a community, most people die. So this is the filamentous Ebola virus, and it's budding off an infected cell. So stop and think. Think back to when we looked at viral life cycles, and there were viruses that had a lytic, where they destroyed the cell, and then those that were lysogenic. So this one is budding off a cell. Those lumpy, bumpy, moon-like things, that is the surface of a cell. And you can see where the major infections have occurred. Yes, in the United States, it was in Dallas. Bummer. And it was someone who'd been over in Africa helping to deal with the pandemic, not the pandemic, the epidemic in Africa. African viral hemorrhagic fever, how do you diagnose it? Symptoms. Treatment involves fluid and electrolyte replacement. They're working on vaccines, but yeah, this is a tough one. So here you have a table, 21.1. Look at some of the viral hemorrhagic fevers. I didn't talk about yellow fever. Um, we don't see that much anymore because we have a vaccine to it. Dengue fever, hemorrhagic fever, Ebola hemorrhagic fever, and Marburg hemorrhagic fever. Um, Look at interesting the natural hosts. Look at Ebola and Marburg. Probably bats. Or they're vectors. It goes from person to person. Okay, let's take a little break. In your notes, draw a line and label this section malaria. Malaria kills more people worldwide than any other disease. It is found mainly in Africa. There is some in South America, but mainly in Africa. And it's a killer disease. It's a really tough disease. And it is associated with sickle cell anemia. So, fever, chills, diarrhea, headache, anemia, weakness, and fatigue. This is caused by a parasite called Plasmodium. And depending on the species, you either have really light infection or a deadly infection. Plasmodium falciparum causes nasty, nasty disease. So basically, what we see is that people who are heterozygous for sickle cell anemia are protected from malaria. This is because there's the red blood cells are misshapen, and enough of the red blood cells are misshapen that the parasite can't invade and establish an infection. Also, the presence of 2 genes for hemoglobin C, a genetic deficiency of glucose 6-phosphate dehydrogenase, and then the lack of Duffy antigens on erythrocytes. What we see with Plasmodium is that a female mosquito, and this is the Anopheles female mosquito, which mainly is in Africa but has also established a foothold in South America, but mainly in the jungle areas. Okay, it bites you and it injects the sporozoites, which is one stage of the Plasmodium, into the blood. The sporozoites are going to invade the liver cells. They undergo what's called schizogamy, which means they develop. About 2 weeks later, the liver cells rupture and the liver's damaged. Fortunately, it can regenerate itself very nicely, but it can be very dangerous as well. It releases what are called merozoites. The merozoites are going to infect the erythrocyte, and then the merozoite becomes a trophozoite, the next stage in development, and what it's called its ring shape. I don't expect you to remember this. I want you to just be aware that this is what happens. So the trophozoites undergo schizogony. They produce merozoites, okay? They rupture the red blood cell, and so you have a lot of hemolysis. And when you have hemolysis, then you're going to have fever. So the damaged liver can't effectively process the amount of hemoglobin. This leads to jaundice. You have this cycle every 48 to 72 hours, so you have a rise in fever, and then the fever goes down, and then they rupture red blood cells, and the rise in fever, and the fever goes down. Some merozoites are going to develop into male and female gametocytes, and then when they do that, they make more little plasmodium. The merozoites then can once they're released, they can infect red blood cells. So they can either develop into male and female gametocytes, and or they can go and infect more red blood cells. So if you're having this infection in the liver and the red blood cells, you've got a lot of hemolysis and a lot of hemoglobin. Then if the liver can't process the hemoglobin, you see jaundice. You see the protein is going to clog up the kidneys, and you can have kidney failure. So malaria, or the plasmodium, hides in the red blood cells. And so the immune system says, where'd they go? Where'd they go? The plasmodium will inject toxins into host cells. They have adhesins. They allow red blood cells to adhere to tissues. And then they can change the host's body chemistry in order to attract other mosquitoes. So they're putting out a scent that says, yo, mosquitoes, come over here and eat. That way more mosquitoes get infected and can then infect other humans. Because this takes place mainly in Africa and third world countries, big pharmacies aren't really doing a lot of research in it because there's not much money to be made. But with global warming, we may see the spread of the vector, and with the spread of the vector, we'll see an increase in the disease, and then Big Pharma will become interested because then they can make money with it. There are some drugs that you can take to prevent, but little plasmodium parasites have become resistant. This is not good. So what they try to do is control the mosquitoes. So they went around, decades ago, they went around and poisoned all the mosquitoes, and then the mosquitoes developed resistance to the poison. Then they decided, okay, we're going to capture male mosquitoes and we're going to castrate them and then release them, and hopefully this will bring down the mosquito population. No, the female mosquitoes weren't that dumb. And then they said, oh, let's use DEET. And so use bug spray. And if you're in that area of the world, use a mosquito net, because that's about the only way you can prevent mosquitoes from biting